We found out Alex was going to have cystic fibrosis when I was pregnant, so I made the phone call here, and I will say, right away, even on that first phone call, they put you at ease. This disease has advanced so much, and hello, and that Cardinal Glennon, was just on the forefront of it. So felt right away that we were going to have a partner, for a long time, in SSM Cardinal Glennon throughout her cystic fibrosis journey.
When Alex was still in utero, the family was looking for a Cystic Fibrosis Center. We were very fortunate that they chose Cardinal Glennon for their cystic fibrosis care.
I remember meeting Dr. Smiley for the first time, and we walked. Sorry. We knew we were going to be dealing with something for a very long time with Alex, and Dr. Smiley just felt like an extension of our family, and it truly has become that. In the 3 years that we've gotten to know him.
We will meet our families through something called the newborn screening, which all 50 states are doing now, and most states have been doing this for well over a decade. But typically, a family may learn from their pediatrician at 2 weeks that there's concerns their child may have cystic fibrosis. Our care team will reach out to the family, and they'll arrange for that diagnostic testing.
I would definitely say that at first, it's terrifying getting that diagnosis. You're shocked. And everything's new to you, but I think when you find the right care team and that really educates you, and having that team there to be optimistic and tell you what's going on has really made a difference for our family.
We're an accredited Cystic Fibrosis Center by the Cystic Fibrosis Foundation, which is important. And then we have a multidisciplinary care team that consists of CF-specific physicians, primarily pulmonologists, but also additional specialties as needed. Other participants in the clinic include social workers, our clinical pharmacists. We also have a pharmacist concierge that can help families with navigating the complexities of the U.S. healthcare system. We have respiratory therapists, we have dietitian, and then we have cystic fibrosis pulmonary nurse navigators as well.
My role on the team as the pharmacist is I make sure that the medicine that the families are given is the right medicine, the right amount, and then I provide education about the medicine for the families, especially the kids. That's my favorite part.
The pharmacy concierge is to help a lot of the families navigate the logistical cost issues associated with some of the medicines in cystic fibrosis.
Did anybody tell you about the Trikafta?
Everyone thinks about lung disease, but early on the real initial presentation before newborn screening was failure to gain weight or failure to thrive. And that's where the dietitian is critically important.
During interactions with patients, we talk about diet, how much they're eating, how well they're eating, how often they're eating. Some of our kids who have CF have pancreatic insufficiency, so their pancreases do not produce enough enzymes to help properly digest their food, and so they experience malabsorption of the nutrients that their body is supposed to be absorbing.
Am I gonna hold you?
We typically introduce our families to the respiratory therapist at about 4 to 6 months of age, since the primary early focus really is on nutrition. But the respiratory therapists are very critical in helping the families develop good airway clearance techniques.
This is gonna go on your nose, you're gonna put that on your mouth, so just breathe nice and easy.
I'm a respiratory therapist in the clinic, and I do spirometry, which is a breathing test that we can check their lung function. And so we'll have a patient come in and blow into a box and a little computer system, and we can check their baseline if they've had any kind of increased cough where their numbers might be down. And so we can, go from there to see if they need treatment.
We have our cystic fibrosis nurse navigators. I work closely with them in the pulmonary division. So these are the nurses who are on the front lines. They get phone calls from pediatricians about positive newborn screens, and they are typically the one that first fields sick calls from our families.
Everyone on the journey, it's been wonderful, so just can't recommend it enough. It really is, you kind of feel that intimate connection. It does feel very personal when you're here, that they really care about each individual patient. Couldn't recommend it enough.
Just people need to be aware that, it's not the end of the world, with CF. There's been very positive diagnosis out there, very positive lights like this little one here, but just ask questions. Ask as many questions as you can, because, eventually it's going to put you at ease, and Cardinal Glennon will put you at ease because they've done such a fantastic job with us. Yeah.
The medical management of cystic fibrosis has changed drastically in the past decade. It started in 2012 with the first of what we call modulators. In 2019, we had a new modulator approved, which is now 85 to 90% of our patients are eligible for these specific medications. And they've actually recently, the age range has dropped to age 6, and we anticipate even younger age range of approval soon. This medication is not a cure, but it's a highly effective treatment. And it fundamentally alters the course of cystic fibrosis lung disease in our patients.
Alex, since she's been born, has been about the happiest little girl in the world. She's not shy. She's energetic and bubbly. She talked early, she walked early. We're very fortunate. She's been very healthy. She loves going to school. She loves being with her big brother. She's very social. So she's just been the light of our lives.